losing their jobs. That's what a wonderful system that is. But the healthcare crisis as well. The fact that we have a healthcare system in which your healthcare in many respects is tied to your job. And we've heard what a wonderful system that is. Well, guess what? When you lose your job and tens of millions of Americans are losing their jobs, that concept no longer seems very, very good. I and the panelists that we have, the great panel that we have this evening, have a very different view of what healthcare should be. We do not believe that healthcare should be an employee benefit. We believe it is a human right that you should have healthcare, whether you're working, whether you're not working, whether you're old, whether you're young, whether you're rich, whether you're poor. That healthcare is a human right, not a privilege, not a job benefit. Now, we have a system today which to me is almost impossible to defend. We are the only major country on earth not to guarantee healthcare to all people as a right. Where I am speaking to you tonight in Burlington, Vermont, is 50 miles away from the Canadian border. And somehow in Canada, they managed to provide healthcare to all of their people. And by the way, they spend about half as much per capita as we do. Canada people live longer lives than we do. Their life expectancy is higher. Their infant mortality rate is lower, and that's true with many countries around the world. In the United States today, despite spending $11,000 for every man, woman, and child, we got 87 million people who are uninsured and underinsured. That was before the economic collapse. Much worse now. We lose between 30 and 60,000 people every year who die because they can't get to a doctor when they should. We have about 500,000 families that go bankrupt in America because they cannot afford to pay off their medical debt. And we pay by far the highest prices in the world for prescription drugs. Wow, what a system. And then we look at where we are today. And it's not just that millions of people are now losing their health insurance. We have to ask ourselves kind of a simple question that I will be discussing tonight. How does it happen that despite spending so much money on healthcare, we were totally unprepared for the pandemic that we're now experiencing? How does it happen that doctors and nurses, medical personnel do not have masks to protect themselves? You might think that's pretty basic. A gown, the gloves that they need. How come we don't have enough ventilators in our hospitals? And the question I also want to throw out today is that while I believe the current healthcare system, the employer-based system, is indefensible, well, why? How did we get to where we are today? Which has everything to do not with healthcare, but with a corrupt campaign finance system in which the healthcare industry last year made $100 billion in profit and therefore has enormous amounts of money to spend on lobbying. My God, they and the drug companies, they have lobbyists not only all over Washington, D.C., but every state house in America, which is why, among other reasons, the pharmaceutical industry can charge you any price they want for the medicine that you need. So we got a big issue out there. And tonight I am so happy that we have just a wonderful, wonderful panel who are with us. We have Representative Pramila Jayapal from the state of Washington.
And you know what can you hear me now? Okay, great.
I can hear you now.
Thanks for having me here on this wonderful panel. Here's what I would say. I actually think that thanks to you, thanks to millions of people across this country who have been dealing with healthcare crises for decades now, that we have won the ideological battle. I actually don't think that we have to convince the American people. If you go across this country and you just ask somebody what is the biggest concern that you have today, they will say healthcare costs. And they will say that whether they're uninsured when it's really, really bad, obviously, or whether they have insurance and they're underinsured. They still can't afford the cost of healthcare that sometimes can run between $10,000 and $20,000 a year pretty easily. And so I think that this is not a question, as you said, of convincing the American people that we need to do this. This is a question of the political will. And this virus, this pandemic that we're in the midst of, has really made it clear how broken the system is. When you have chronic disease, chronic conditions that people have because they delayed healthcare, because they haven't been able to take their medications, their treatment, they are the ones who are most at risk for getting the virus. And when you look at the fact that, you and I for years now, we've been talking about how there's no real choice in the employer system. Well, here you go. I mean, everybody said, oh, employer system offers so much choice for healthcare. No, not if you lose your job, it doesn't. And I think that employees have been saying that for some time. They don't want to be tied to one employer. They want their healthcare to be there regardless of who they work for, regardless of what opportunity they choose to pursue. If they need to stay home, they want their healthcare to be there. And so 35 million people potentially being added to the rolls of the uninsured, already 30 million, I think has shown people how politically necessary this is, how morally right it is, and how we just need the courage to, put the barriers on those 500 lobbyists for every member of Congress that exist in the halls of Congress. Stop listening to them. Let's start listening to the people.
Pramila, you have done a great job in the House. And as you indicate, I don't think it's a question of winning over the American people. I think they are there with us. I'll talk a little bit about the kind of progress and support you have for your legislation in the House.
Yeah, it's been amazing, actually. We were able to get 4 hearings in the House of Representatives and major committees of record. That's the first time that has ever happened on a single piece of legislation. We have over half of the Democratic caucus, including most of the leadership, signed on to the bill. And we have built tremendous support with you of labor unions. This is the largest coalition of labor unions because I think, sometimes people don't realize this, but if you've got a buck at the bargaining table and you got to spend 60 cents of it on healthcare, that only leaves 40 cents for wages. And so unions are clearly seeing the stagnation of wages being tied to the increasing amounts of healthcare costs. But also we've built the first major racial justice coalition for healthcare now with the NAACP and many other racial justice groups saying, we know that Black and brown folks are deeply disproportionately affected. You certainly see it in the fatality rates of African Americans with COVID. 70% in Chicago of the fatalities are African Americans, 81% in Milwaukee County are African Americans. This is criminal. So we're excited about the support we've built in the House. I believe we can continue to move this. And this is actually a really good time. And we are ramping up our efforts to say to people, this is the solution we need. We can't hide behind, oh, it's too hard. Oh, it's too difficult. This is not naive. People are dying because they don't have access to healthcare. And if we had a centralized system that assured healthcare, we would still have a pandemic, no question about it. But our response would be significantly faster. We would have significantly less chronic conditions, and we would be able to come out of this with some real lives saved. And that needs to be our focus.
I think one of the points that Pramila just made, and we discussed this issue here a couple of weeks ago, is that when you have poor people, when you have African Americans and Latinos who don't get the health care that they need, who are living in poverty, what you have is a lot of untreated disease. You have more diabetes, you have more high blood pressure, you have more obesity, you have a variety of illnesses which this horrible virus is preying on. So people who have poor immune systems are the most vulnerable to this illness, and those people who have not had the health care that they need are in fact the people who are dying at the highest numbers. Okay, we lost Pramila's sound. Pramila, you there?
Here.
Okay, good. Oh,
Can you
you're
hear
getting
me?
calls on your phone. Okay.
Yeah.
All right,
sorry
with
about
that, let me, Pramila, thanks a lot. I know you've got to run.
Thank you.
Thank you for being here, and thank you for all the great work you are doing. Let me go to Dr. Abdul Sayed, who is in Michigan. Dr. Sayed, thank you very much for being with us tonight. Why are you a supporter of Medicare for All?
Well, it's always a privilege to join you, Senator. I really appreciate the opportunity in the space to talk about this.